But today we are absolutely delighted to be joined by three special guests, Sheila E., the world-renowned percussionist and singer, Natalia Kanem, the executive director of the UN Population Fund, and Mark Johnson, the founder of Playing for Change. They will brief you on the upcoming Peace Through Music, a global event for social justice. But before we get to them, we have a couple of news items to share with you. On Ethiopia, you will have seen that the Secretary General spoke spoke on Friday with Ellen Johnson-Sirleaf, the former president of Liberia. She informed him on the contacts she's held between the envoys of President Cyril Ramaphosa in his capacity of chair of the African Union, president of the African Union, namely Joaquim Chissano, the former president of Mozambique, and Kgalema Motlanthe, the former president of South Africa. Those discussions they had with the Ethiopian authorities, particularly with the Prime Minister of Ethiopia, Abiy Ahmed. The Secretary General expressed his grave concern over the consequences of the Ethiopian conflict to the civilian population over the spread of hate speech and reports of ethnic profiling. The Secretary General expressed the UN's full support for the African Union initiative led by President Ramaphosa. And I also need to share with you that yesterday, the Secretary General received a phone call from Prime Minister Abiy of Ethiopia to update him on the situation in the country. The Secretary General once again underscored the need for the full respect for human rights as well as for humanitarian access for ourselves and our humanitarian partners. The Secretary General also said that Ethiopia needed a true reconciliation without discrimination, and in a country where every community should feel respected and be part of Ethiopia. On the humanitarian front, our humanitarian colleagues and our partners are telling us they are, of course, deeply concerned about the plight of civilians in the Tigray region, especially in the capital Mekelle, following the latest developments reported in the city. Even before the recent fighting began, civilians in Mekelle, which is home to nearly 500,000 people, had endured weeks of fuel, cash, and basic commodity shortages. Civilian infrastructure had also been damaged. Our humanitarian colleagues have received reports of critical shortages of medical supplies in Mekelle and across Tigray to treat people injured during the clashes. Aid workers report that they have been forced to rely on untreated water to survive following the damage and destruction of water infrastructure. Our humanitarian colleagues are also warning that it is critical that essential supplies and services be restored immediately in Mekelle and across Tigray region. We, and along with our partners, are working with all parties to this end. The UN and its humanitarian partners also acknowledge that the federal government's stated commitment to ensure humanitarian assistance is made available to impacted people and calls for full, unconditional, and immediate humanitarian access to reach people in need in Mekelle and across the Tigray region. And in neighboring Sudan, people are continuing to flee, where we are reporting now that 45,500 people, most of them children, have fled to Sudan from Tigray and other places of Ethiopia. In Sudan, aid workers are reporting complex logistical operational challenges. They're scaling up the response with the first UNHCR airlift with emergency assistance arrived in Khartoum over the weekend. UNHCR has warned that the urgent need for additional refugee settlement sites in the Rukuba camp in Gedaref state has reached its current maximum capacity of 10,000 people. And in Nigeria, you will have seen that we issued a statement yesterday in which the Secretary General condemned in the strongest terms the horrific attack on rice farm workers in Koshobe village near the Borno state capital of Maiduguri. This was done by suspected militants on November 28th. Scores of people were reportedly killed and many others injured or abducted, including women. The Secretary General reaffirms the commitment of the UN to support the government of Nigeria in its fight against terrorism and violent extremism and in response to pressing humanitarian needs in the northeast of the country. For his part, the UN resident and humanitarian coordinator in Nigeria, Edward Cologne, also expressed his outrage and horror at the attack. Mr. Cologne will join the governor of Borno State soon on a visit to express his condolences and support to the families of the victims of Saturday's attack. And speaking this morning at the opening of the state's parties on the Convention on the Rights of Persons with Disabilities, the Secretary General said that realizing their rights is crucial for fulfilling the core promise of the 2030 Agenda, leaving no one behind. For the most part, he said, the UN system is still beginning to consider disability inclusion in a comprehensive and coordinated manner. The UN system-wide disability inclusion strategy launched last year aims to address the issue and to bring about a lasting transformative change in the organization's work on disability inclusion. 1 year on, Mr. Guterres said the strategy has triggered action across the system. Through the implementation of the Disabilities Inclusion Strategy, the UN system is working to lead by example, but as we move forward, Mr. Guterres said we must take a whole-of-society approach. We must also ensure that the vision and aspiration of persons with disabilities are included and accounted for in a disability-inclusive, accessible, and sustainable post-COVID world. A couple of updates from our peacekeeping colleagues. The UN mission in Mali confirms that the camp shared by UN peacekeepers and the French force Barkhane, located in Menaka and Kidal, came under indirect mortar attack this morning. This followed an early attack on the Barkhane forces in Gao. There are no reports of casualties. The head of the UN mission, Mohamed Saleh Al-Nadif, strongly condemned the attacks against the international forces. The UN remains in solidarity with key partners and will spare no efforts to carry out the mission's mandate and to bring peace to Mali. Turning to the Democratic Republic of the Congo, where the peacekeeping mission there has launched a new radio station in partnership with UNICEF called Okapi Enfants, and the new radio station will help inform children about their rights as well as risks associated with epidemics. The creation of the new station follows the launch in April of the program of Okapi School on Radio Okapi that aimed to bring education to children in their homes in the context of the COVID-19 pandemic. Meanwhile, the mission in South Sudan deployed a Nepalese Quick Reaction Force team to Quibet in the country's lake region to support local police in their efforts to protect civilians from a potential conflict between armed groups following the killing of a young man. The UN peacekeepers, who'd been located in a temporary operating base, intercepted the group quickly and set up a checkpoint between them. They remained in the area until the situation was stable. As part of its mandated activities, the UN mission has established temporary bases in conflict hotspots in South Sudan, where integrated military and civilian teams work to deter violence, support reconciliation efforts, and help communities reach agreement to peacefully coexist. The work is done to provide protection quickly where it is needed the most. And the World Health Organization today called on countries and global health partners to step up the fight against malaria. WHO stressed that a better targeting of interventions, new tools, and increased funding are needed to change the global trajectory of the disease, reach targets, and agree to internationally. According to WHO, the latest World Malaria Report in 2019, the global tally of malaria cases was 229 million, an annual estimate that has remained virtually unchanged over the last 4 years. The disease claimed by some 409,000 lives in 2019, compared to 411,000 in 2018. As in past years, the African region shouldered more than 90% of the overall disease burden. The organization also noted that gaps in access to life-saving tools are undermining global efforts to curb the disease, and that the COVID-19 pandemic is expected to set back the fight even further. Couple of more notes to flag. Tomorrow, our colleagues in the Office for the Coordination of Humanitarian Affairs will present the Global Humanitarian Overview 2021. This is the annual overview of trends as well as current state of worldwide humanitarian needs, projections, and interagency response plans. This includes an overview of the funding necessary to implement them in 2021. The launch will take place in Geneva in a virtual event that will be live streamed on the UN Web TV from 9 a.m. to 10:30 a.m. European time. Subsequent events will take place in Berlin, Brussels, London, and Washington, D.C. More information on OCHA website. And today is the day of remembrance for all victims of chemical warfare. In a message for the day, the Secretary General noted that more than 100 years after the first large-scale use of chemical weapons in battle, they continue to inflict terror, suffering, and death. He stressed that the use of chemical weapons anywhere by anyone under any circumstances is intolerable and a serious violation of international law. And he emphasized that it is imperative that those who use or have used chemical weapons are identified and held accountable. For him, that is the only way to meet our moral responsibility for the victims of warfare. And tomorrow we'll be joined by Ninan Varugezi, the acting director of UNAIDS office, who will brief you on the World AIDS report. And at 1 p.m., there'll be a hybrid press briefing by Ambassador Jerry Machila, the permanent representative of South Africa to the UN, who will preside over the Security Council for the merry month of December. So before we go to our guests, I will take some questions. Yes, please go ahead.
Is that me?
No, go ahead. Wait 1 second, Abdelhamid. We'll take it in the room first.
Hi, Stéphane. Every day more pharmaceutical companies are announcing success for their COVID-19 vaccine. As United Nations, is there any efforts to help in the underdeveloped countries, mainly in Africa and Asia, getting the vaccine in the future or near future? Thank you.
Yes, it's a big focus of the work of the UN, obviously the World Health Organization. It is critical that the vaccine be treated as a global public good. You have various initiatives, notably COVAX, that are aimed at supporting access to the vaccine by middle-income and low-income countries. What we do not want to see is that only the richest countries get it, or that the richest in the richest countries, or even the wealthiest people in the poorest countries get it. Everyone, everywhere needs to have access to the vaccine. And I think we all understand that none of us will be safe from this virus until all of us are safe and have access to the vaccine. Abdelhamid.
Thank you, Stéphane. I heard the Secretary General issued some statement about the assassination of Mohsen Fakhrizadeh, the Iranian scientist. I think he mentioned the word calling for restraint. Such a crime with this magnitude, how could he not unequivocally condemn it?
Well, listen, I think we were very clear that we, of course, condemn any assassination or extrajudicial killing. That goes without saying. And that the situation in the region is volatile enough, and that the Secretary General would call for restraint.
But again, to repeat some generic statement about the principal position is one thing, and to condemn this heinous crime is another thing. Why he didn't boldly condemn this assassination? Isn't a state to sponsor terrorism?
Abdelhamid, we condemn assassinations, we condemn extrajudicial killings. I don't know how much clearer I can be on this issue.
Okay.
Evelyn,
I have a second
please, sorry, go ahead.
I'm sorry. Okay. Yesterday, it was the International Day of Solidarity with the Palestinian people. Did the SG issue a statement or?
Yes, I'm sorry. We should have flagged. There was a statement, and you will have seen there was a tweet as well from the Secretary General.
Thank you.
Okay, Evelyn. Evelyn, go ahead.
Can you hear me now?
Yeah.
Yes, okay. Thank you, Steph. On Ethiopia, I noticed that that there's no mediation, that the government in Addis has rejected it. The AU and other envoys can speak to the government in Addis, but are not permitted to speak to the TPLF or other Tigray leaders. Has the SG intervened regularly with the government
I think,
for this?
there is a mediation team sent by Cyril Ramaphosa as head of the African Union. The Secretary General has been in touch with them. He spoke to Ellen Johnson-Sirleaf. And as I mentioned, he received yesterday a call from Prime Minister Abiy, who updated him on the situation in the country. And the Secretary General's messages to the Prime Minister privately are those that he said publicly, which is the need for full respect for human rights, the need for humanitarian access. I mean, I think I've outlined the very dire humanitarian situation that we can only really guess at this point. We have some information, and we're seeing people flee across the border into Sudan, but it is clear that we do not have a clear picture of what is going on in Tigray province, and that the Secretary General underscored the need for true reconciliation in Ethiopia between the various communities without discrimination, and where all these communities feel fully part of Ethiopia.
That's true. The mediation team, however, has not been able to speak to the Tigray.
Well, listen, I can't. They are working for the African Union. We fully support the African Union's lead on this issue, and the Secretary General and his team are doing whatever they can to support them.
Thank you.
Okay. Edie, welcome back.
Thank you very much, Steph. A question also on Ethiopia. Has the United Nations made any requests to send people into Tigray? Have they been accepted? Have they been denied? Humanitarian people, anybody to talk to the Tigrayan leaders?
We have made requests to the federal government and to others to have access where humanitarian aid can be brought in. I mean, there's a shortage of water. Water plants have been destroyed. There's a shortage of fuel. Banks have been closed, which means markets have been closed. So there's a humanitarian toll. There's an economic toll, which has a direct impact on the humanitarian situation. We have made these requests repeatedly. We have not been able to access in large scale. There is a small number of humanitarian aid workers in Mekele when the fighting began, and we have a small number of UN staff and NGO staff also present in Mekele, but they are cut off. The communications are extremely difficult, and we're very worried about the people in Mekele, and we're concerned about our colleagues as well.
A follow-up.
Yes, go ahead.
Stéphane.
Go ahead.
Thank you again. There are reports that Eritrea has been involved in the fighting. They prevented refugees running away from Tigray to enter the border. Do you have any information about the Eritrean intervention in this internal conflict?
No, I do not. We do not have any information on that. It is very important that anyone fleeing the fighting, whether trying to flee internally or to cross borders, be allowed to do so. No impediment should be in front of anyone trying to seek shelter, trying to seek safety for themselves and for their family. Okay. Thank you very much. I don't see